Hi, everyone. Welcome. Thank you so much for joining us today for Real Talk, the realities of being and becoming an IBCLC. I'm Angela Love-Zaranka, Program Director at LER. Sekeita?
I am Sekeita Lewis-Johnson, the Accredited Provider Program Director here at Lactation Education Resources. Welcome and thank you for joining us this afternoon, evening, or night.
So wonderful that you're here today. Just to give you a little background about myself, I have been working in lactation support and either in the community, in a hospital setting, as well as served on different boards of directors, creating policy and providing advocacy for folks for many years. How about you, Sekeita?
Yeah, almost the same, Angela. I am a lactation consultant and also a family nurse practitioner. I've been providing lactation services for a while now in the hospital, as well as outside of the hospital in the community that I serve. I also wear the hat of being a nurse educator. And so, yeah, I'm happy that you're in this space and we're going to try to give you all the realities of becoming what it's like to become an IBCLC.
Great, wonderful. So for those of you who are joining us, if you have any questions, take a look at the GoToWebinar platform and you see where that blue arrow is pointing. If you're on a desktop, you will actually see in the interface that little gray box where there's a question mark there. That's where you can find in order to ask a question, find the link, click on that, and you can ask us any sort of question, or you can comment if you'd like. If you are participating on a mobile device, it can be found along the bottom bar of the app as a question mark, as indicated by this green arrow. Go ahead and give it a try right now. Either type the question mark either in either interface, whichever one you have access to. Go ahead and tap that and ask us a question, or better yet, if you could provide us with the name and location of where you are participating today, that would be delightful. It's always nice to know where people are, and we're happy to tailor our responses accordingly. Now, joining our webinar today from LER, we have Sonia Kuipers, who is a part of our tech support team. And Sonia, if you have any tech issues, Sonia is more than happy to answer them, or Sekeita or I or Wendy can answer it as well. Now, Wendy is also part of she wears many hats and is part of our customer support team. So Wendy is going to be taking a look at the questions in the chat, and we'll leave a few for Sekeita and I, but she's going to answer a bunch of those herself. And so if you have any issues, please do let us know how we can support you in getting the most from this webinar. Also, you could contact us at support@lactationtraining.com. Okay, so let's go ahead and get started. Becoming a lactation consultant, how can you follow your passion and become one? Well, if you do decide that you'd like to be one, you will join more than 37,000 IBCLCs in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Certified Lactation Consultant Commission. Take a look at their website, which is ibclc-commission.org. They have different regional offices depending where in the world you work or reside. Take a look at the requirements and the pathways to become eligible to take the IBCLC certification exam. What do you need to know? Well, the detailed content outline or the exam blueprint is based on a survey of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves lactation consultants training. Its full name, besides the acronym of LARC, is the Lactation Education Accreditation and Approval Review Committee. Now, Sekeita is going to review a few questions that you want to ask yourself today as you're contemplating this road. Sekeita?
Yes, thanks, Angela. So before we begin today, here's a few questions I want you to perhaps write down, but definitely ask yourself. One of the things I've always asked some of our participants to do is to write these down and then journal about it later. But the first question is, do I have the skills necessary to become an IBCLC. And so when I talk about skills, most people automatically jump to clinical skills, touching, hands, all the things that we do, yes, as lactation consultants. But I'm talking about some of the intangibles. I'm talking about our ways of being, how we show up in clinical spaces, also our competencies, all of those things, but a little bit more than just the tangible in touch. The other thing is if you don't have the skills, you need to ask yourself, where will I get these skills? So in the next few slides, I'm going to talk from the perspective of what encompasses, what does it take to become an IBCLC, and the realities of that. And Angela is going to talk about the pathways. And so these are questions that you really want to be cognizant of as we go through today's presentation. All right, so the first thing is first. I mean, like, kind of a no-brainer almost, right? Competency. Because I know if I were to see a heart surgeon, I definitely want them to be competent on how to perform heart surgery. So realistically, though, competency means that a person has the ability, the knowledge, the skills, and the attitude to do a task or something and to do it successfully. That could be communication, and that's why I said or something. Communicating successfully, right? So in a nutshell, are you competent? Will you be a competent practitioner? And one of the things that, as Angela started to talk about the pathways, one of the things I want to recognize and amplify before we get into that portion is, in order to become a competent provider, you need to have developed some skills. You need to have had some clinical experience. And so while I respect all educators, I am one. I am also an educator that continues to practice, because I don't want to be so far removed thinking I can just educate on things that I really have no practical skills in, right? And so are you competent, and where are you going to get your clinical skills to become competent? And, you know, when we think about competency initially, everyone has an entry level into the field. And so I'm really talking about, are you competent as a novice? Because most certainly, once you get into the field, you will continue to build up on your skills. You will be able to build up on your knowledge, and then you'll be able to master and go along the continuum of becoming an expert. So do you have the foundational knowledge to be competent enough to not cause harm? And that is why competency is so crucial, and it is really the foundation of what we do. Are you culturally appropriate and credible? You know, the word culturally appropriate, sometimes folks need to really unpack what it means. If you work in healthcare, sometimes you've heard the word culturally competent. You know, there's rules of thought around the word culturally competent, like, can you ever be competent in someone else's culture? Because it determines a level of mastery, right? So some of the words that are very clear, or a little bit at least more clearer to us, is care that is culturally humility, care that is delivered in a cultural humility form, which could then be deemed as culturally appropriate. So it's more fitting for us to use words that we're really intentional about, so that we don't fall into stereotypes. We don't fall into saying this culture does that or that culture does this, because we know that within cultures there are subcultures. When you go into any clinical situation thinking that you know what someone will do based on their quote unquote culture, that's a great way to lose credibility. But when you go into it with the mindset of cultural humility, which means you've examined everything about your process, your beliefs, your values, and understand that we all differ, and you go into clinical situations with that understanding, you build credibility. The key thing about credibility as a lactation consultant is, if you lose credibility as a practitioner, other IBCLCs will most certainly lose credibility. So it's very important to make sure that when we are going into spaces, we are carrying in our cultural appropriate hat and we are credible. The other thing with credibility is if someone asks you a question, remember I said we start off as novices. Someone asks you a question, do you go off a whim? Do you go off of your past experience of providing human milk to your child or past experience of only clients that you've serviced? If you go off of that and not really what the evidence says, that's another way to lose credibility. So one of the things that is always alarming to me is, someone will say, oh, it was painful. And, well, it didn't hurt me. Well, that doesn't help the clinical situation, right? And so what it means is being credible enough to know that if you don't have an answer or a solution for a given situation, that you have credible resources that you can use as backup and tools, but that you actually say, you know what, let me get back to you on that question, right? That shows that A, I care about you, I see you, I want to help you with this problem, and B, I don't know it all, and I'm not going to pretend to. And that is also how you gain credibility. Policy advisor and creators. So one of the things we do as the IBCLCs is we advise on policies. Some of us write policies, some of us are stakeholders, whatever your role is in policy creation, and we all have a role. That is to be at the table. One of the things about policies is that, policies are written in language, and sometimes some of the language that policies are written in can come with unintentional consequences because folks who write policies sometimes may not know anything about lactation. So it's crucial for us to be involved, aware, and be an advocate for fair and just policies as it relates to the families we serve, as well as our profession. So some folks who, for example, may have a background in policy already, great, we need you. But just because you have a policy, or if you don't have policy experience, we also need you at the table advocating and creating policies and helping to form and shape those policies, which could be beneficial to not just you and the profession, but also our families. So I say policy is your strong suit. Yay, come on in. We need you, but also make sure that, you know what, if policy is not your strong suit, you are still in the policy arena and identifying yourself as a stakeholder in the profession. Problem solver and researcher, they go hand in hand. In some ways, they're similar. But being a problem solver is about 90% of what we do as lactation consultants. When we come in, families have all different concerns. Now, sometimes we say common complications of lactation. There's these common things that happen. However, a common situation may not be so common when there are the family's dynamics or barriers that may be in existence. And so we really want to be very cognizant that when we're called for support, it's usually secondary to some type of problem or issue, right? So really understanding that not one size ever fits all, because as I said, the family's context matters. And so it might be a common issue that you've been called for, such as a difficult latch, but contextually, you really don't know what's going on. So be mindful about framing lactation concerns from this one-size-fits-all framework. Know that one size never fits all. Know that we should really be problem solving from the lens of this individualized approach to care, and that individualized approach should be culturally appropriate. So I'm sharing that with you to understand that there's the problem solver and then there's the researcher. Remember I said sometimes you have to say, I don't know the answer to this. And you go look that up. Well, that's being a researcher. But you know what, the lactation field is a fairly newer profession if you think about the 80s when, you know, the credentials and all of the things started to come up. There's a lot of research that needs to be done, and that's academic research. So there's two ways to become a researcher in this field. There is, I need to go and look this up so I can be a credible practitioner and clinician. And then there's the other way of diving in and doing actual research studies that help advance our profession. So those are the two ways that IBCLC show up. We have lots of IBCLC researchers. We need more, of course, but, and I shouldn't say we have lots in the scheme of things, but I know a few. How about that? High-level skilled lactation care. This almost needs to be one word. One of the things that I started off talking about is I started talking about competency. Competency is basically building your skill set and building your knowledge set. However, we know that along the continuum of lactation care, there is a lactation acuity model that was developed by Rebecca Mano that talks about what does it mean to be high-level lactation acuity. There is level 1, which is the normal, more subtle, more, I need maybe just a little bit of support. And then there's the level 2, which is no, I need a little bit more than just, you know, regular like basic care. And level 3 is a high level case. Your high level case, and the actual concept of lactation acuity is built on the premise. It includes factors of the birthing person or mom and the baby. What risk factors are each individual person carry, and combined together, how might that lead to premature weaning? So the fact is to deliver the highest level of care to those that have the highest level of need, right? So almost like how ICUs operate, right? So you could actually have someone, a person who has birthed a child in the ICU. And how do you care for that person? How do you look at the medications? How do you look at that person if they're intubated and be able to provide the level of recommendations that the entire team will need in order to help this person to be successful once they become extubated? So that's what I mean about high level skilled lactation care. That is what sets the IBCLC apart. So I know that folks will get into the field having done a whole lot of counseling, having done a whole lot of education, and having done a whole lot of, you know, sitting with level 1 cases. However, I want to challenge you to think about these other experiences. I want to challenge you to really look at the lactation acuity framework and be able to say and think through, yeah, I can deliver level 2 and level 3 because that is what IBCLCs are called to do. Essential and timely. The word essential became a buzzword, we know, in the pandemic. I want to challenge you to understand that it's not a buzzword for lactation consultants, and timely access to skilled lactation care is critical, which means we are essential. And we did find that out during the pandemic when folks were calling for assistance because the length of stay at hospitals didn't really warrant a lot of, didn't really warrant, or it warranted, I'm sorry, but they didn't get the level of care that they needed before discharge because discharges were occurring so fast. And so what was happening was families were in need of a lot of support, which meant during the pandemic, some of us had to be going in a timely manner to go and see families and try to be as safe as possible. So we found out that yes, we are essential. We also found out that yes, telehealth works. However, there are some drawbacks to telehealth as well. So telehealth only works in some situations, not all. There are times when there's a lack of bandwidth. There's also times when a person may not even have the resources to be able to carry out telehealth. And so being careful and understanding that, you know what, timely access to skilled lactation support can definitely make or break, if we're not there, a lactation journey, and also can actually lead to unintended health consequences to families. And so understanding that our role as lactation professionals is to try our best to deliver that type of care. And if we can't, to have a network of folks that if I can't get to you, I know someone who can. I need to refer. I need to have these other resources, because timeliness is it when it comes to lactation support and the skill level. Becoming a trusted collaborative care partner. I love the phrase collaborative care partner, and I've talked about trust in the beginning when I talked about credibility, but I love this phrase so much because what it assumes is that you are collaborating with your client. You are collaborating with your family. It assumes that you are not the center. You are not the decision maker. You don't get to determine the goals, any of those things. You are there to assess their goals and to help them achieve whatever their goals may be. A lot of times it is their barriers that takes precedence over any goals that we may even think about for our families. So we know that the World Health Organization and many other governing agencies recommend exclusive breast milk, human milk, for the first 6 months. We know that, right? And some families say, I have an exclusive feeding plan for at least 3 months, right? We can educate, right? It's okay to educate, but at the end of the day, we know that it is their goals that takes precedence, and that it's extremely important that we honor and we still talk about recommendations. However, we also have to understand that we're collaborating in partnership, in agreement, and when someone seeks our care, that we approach it in that manner and that we don't overstep boundaries that are not meant for us to overstep. And so in essence, that's how you become trusted. In honesty, that's how you become trusted to do no harm, to be reliable, trusted to say, I see you as a person. I see we're in this together. I'm not higher than you. We are collaborating to do what is best for you. One of the mishaps that happens, and I've seen this happen, and I continue to see this happen. Just a few weeks ago, I got a phone call about something relatable that happened. But when you go into clinical relationships and assume a hierarchy, and I know that some of us that are have worked in the medical field are used to and understand what I mean about hierarchies. But you go in like, I'm the expert. I know all about this. I've been teaching this breastfeeding for 15 to 20 years. I'm going to tell you how it should work. You go in with your spiel. You go in with the same thing you say day in and day out to every single person, right? You're going to lose a lot of people. When you go in and touch someone without asking permission, and they say they wanted assistance with latch, and you just go in and say, okay, here you go. I helped you, right? That's not a collaborative spirit, right? You're not collaborating. That is you assuming that you are the center of this person's concern. So just want to be mindful, and I wanted to really unpack what that means as it relates to becoming an IBCLC, because we need to really shift the paradigm and really operationalize person-centered care, which is my next slide. So there you go. Person-centered care. So, person-centered care also is a buzzword, particularly in healthcare. And what I want to really, really, really allow for a paradigm mind shift is that I've already talked about culture, I've already talked about care, communication, and collaboration. We have to come to a point where we can operationalize the person at the center, right? And so I'm going to give you the Institute of Medicine's definition, which is providing care that is respectful of and responsive to individual patients' preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. I can honestly say a lot of times that happens, but I can also say a lot of times it doesn't. And so what I'm saying for IBCLCs, what it takes is to really operationalize person-centered care and don't allow it to become a buzzword. Really go in with a real holistic view of the person being the center of it. So I want to leave you with that. I also want to leave you with some anticipatory guidance that, and some more questions to reflect on, to write on. Angela's going to jump in and she's going to start to talk about, the pathways. But as we talk about the pathways, there's some additional questions I want you to write down and ask yourself today. What pathway is the most appropriate pathway for you? And when I say that, I mean, what pathway are you going to get are you going to come out being the most competent, skilled, novice lactation professional that you can be? What does the local market look like around you? Is your area saturated with lactation consultants? I'm going to say not. There's not one area I know in the world that's saturated with IBCLCs, right? But I do want you to get a sense of, what are you thinking? Are you thinking private practice? Are you thinking working in the hospital? What does that look like in your area? The other thing is that becoming an IBCLC, it takes clinical hours, it takes study, it takes time outside of your family. It also takes time outside of work. So really reflecting, and this is another journal question perhaps, is how does this fit into with my life right now? Like, what things do you have going on right now that you can say, okay, maybe let me put this off for a year. Oh no, I'm jumping in right now, right? But really be intentional, because the more you can be intentional about your journey and your path to becoming an IBCLC, the more successful you will be in the long run. And so with that, I will turn it over to Angela. Angela, take it away.
Thanks so much, Sekeita. Really appreciate you framing it and framing the conversation in this way. Really appreciate that. Okay, so this is the roadmap to becoming an IBCLC. And it can feel a little bit complicated, but I'm going to break it down and give you this roadmap. Now, we're going to touch base on this later in today's presentation, but as you're listening, know that you don't have to go out and find each one of these things. LER has ways to help you with each step of the process. So first, you need to choose a pathway. We're going to come back to this in just a minute. Each pathway has 3 components. There is the education piece, there are the clinical hours, and then there's getting ready for the exam. Okay, first component, health sciences education. This is the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education courses. You can find a full list of the 14 subjects on the IBCLC Commission's website. You can search for it, or you can find a link in your resource document. Remember where you found the question box? I believe right above that is where you can find the handout for today. Now, these 8 university level courses are, and you don't have to write these down right now, but they are biology, anatomy and physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally sociology or cultural sensitivity or cultural anthropology. They can be online or in person as long as the institution is accredited to provide the learning. Now, if you took those courses a few years ago, if you were in college a few years ago, even if it was 20 years ago, those courses will count. LER partners with Walden University to provide those basic courses. Walden is online, and they've chosen the courses that best fit the Commission's requirements. Now, the 6 general ed subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. So 5 of those 6 general ed courses can be taken through LER. The only one you're going to have to search for is basic life support. In many countries, there's an in-person skills check for this training. Now, I have heard of some organizations providing this training completely online, so it's important to check with your local resources. The guide provides general descriptions for typical courses in that subject area. Please keep in mind that the IBCLC is international. The names which are used in that document to describe the courses may not exactly fit the description of the course at your accredited educational institution, and that's okay. You will note these broad terms with the understanding that there is no one universal definition of what a course in clinical research will cover. So why are these 14 courses required? The IBCLC is a standalone credential, meaning you don't need another certification or degree or license to practice as an IBCLC. Once you pass the exam, you are an allied healthcare professional. The courses will help you be prepared for your career as well as help you to pass the exam. So the second thing you need is lactation-specific education. This we have in so many different ways that meets the entire detailed content outline, and your education should be something which is also comprehensive. So the commission requires at least 90 hours of lactation-specific education and 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. So how many clinical hours do you need? Well, that is where we talk about the pathways. So a quick overview is that Pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Now, healthcare professionals, according to IBCLC, includes physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, and the Australian Breastfeeding Association. Now, Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 clinical supervised hours working with breastfeeding families. One quick note is that there's only a handful of these universities around the world. Just something that you want to note and be aware of as you're searching if you choose that you want to take Pathway 2. Now, Pathway 3 is a structured mentorship program between an IBCLC and the applicant. The IBCLCs, or if there's more than one, all IBCLCs must be in good standing with IBLCE. Those who choose this pathway must have their program pre-approved by IBLCE prior to beginning their clinical hours. Now, a quick note. For those of you who may have breastfed or chest fed or provided human milk for your baby, the hours you spent nursing, pumping, and helping your friends sadly doesn't count towards the exam. Now, while 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. As Sekeita mentioned earlier, and I know I myself, we're always learning every day, which is why we keep our active clinical practices. Now, if it's any consolation, the number of clinical hours you needed in the past was a lot more. I've known some people who needed 2,500 or 8,000 clinical hours just to take the test. So candidates who are applying for the IBLCE exam through Pathway 1 need at least 1,000 hours. For candidates who are also a healthcare provider, those hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours can be earned online or in person. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. So 2 important points about clinical hours. It's important for you to document the hours as you accrue them. Be very detailed in case IBCLC chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or some other document where you counted your hours. And the other important point is that the hours do not need to be directly supervised. Now note that LER does have a program for those of you who are not already affiliated with a breastfeeding support organization. It's for anyone who takes our course and is a certified breastfeeding specialist. It's called the LER Hours Program, and it offers you a way to gather those 1,000 hours in your community. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with as many breastfeeding, chest feeding people and those who are providing human milk for their babies each day, such as a hospital or a clinic setting. Now, the 500 hours count when you're actually working with families. Observation hours or orientation hours do not count. Remember that clinical experience is graduated. That is, it starts with observation, then doing tasks under supervision, then completing those tasks independently with the IBCLC nearby to ask questions and discuss situations. Now, LER has an internship program with many sites around the US. Reach out to support at lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate the internship site with LER as your education institution. Now, one thing Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns are going to spend about 75 hours in orientation before you can begin to accrue your 500 hours. Or take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find that good fit. Talk to other people who've been through Pathway 3 to find successful strategies with finding a good mentor. Now, while this pathway has an additional step or two, is it worth it? It is. Well, we find, and I take a look at the test analysis report from the IBCLC every year, and they seem to show that the evidence shows us that people who go through that Pathway 3 program score best on the exam. I think it's that mentorship, and that's the key component, having someone there to ask questions to or to seek their clinical experience and to sort of go through their clinical experience in order to try to help you to find solutions to help that specific, in order to help that specific family. So yes, there is extra work involved in the beginning, and if you can find that internship site or that mentorship program with the IBCLC, it's worth that extra effort. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic, which some people will say we are still in the pandemic, and that quick answer is yes. The longer answer is paraphrased from IBCLC documents. They will allow the use of technology if certain parameters are met. You will need to pay attention to privacy rules and the Code of Professional Conduct and clinical competencies for the IBCLC. It's really important to keep an eye on the IBCLC news that comes from their website because indeed, whenever that is updated, they will let us all know there. Now, there are two different ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, which is the full 95 hours front to back. Or the other one is the Core or Bridge course. They're designed to meet your education needs depending on your background and if you have any previous training. Now first, the Comprehensive Course LCTP, Lactation Consultant Training Program. It's a 90-hour course which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and they know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we will update sooner as new evidence emerges. Have a question for one of our instructors? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect. Stay tuned for more information. Now, upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education that you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam if you're in our hours program. So do note that that is a separate program. Now, if you're not sure where to start, or you already have some lactation-specific education hours, then we have our core or bridge program to meet your needs. They have the same advantages as the LCTP course. Now, our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52 hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have basic lactation education components and they need an extra 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, clinical skills videos, and many more. So if you're not really sure where you want to start, well, I would say if you're new to the profession, I would suggest the core course. Get your feet wet and see if there's something that fits for you. Now, I know these requirements can seem like a lot, and we are here for you every step of the way. If you have any questions about the pathways that don't get answered here today, please be sure to reach out to our friendly customer support department. Many of our team are IBCLCs, and they know this process inside and out. LER has 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. If you're not a health professional working directly with parents and babies, getting those hours can feel like a challenge. We have 2 programs, one for Pathway 1 and one for Pathway 3 students. And when you're ready to take the exam, LER has you covered. We have 2 versions of our very popular exam prep course. Both use LER QBank, which is a comprehensive system which includes practice exams, photo flashcards, anatomy flashcards, a study schedule, and more. For those who take our 95-hour course, we include a discount to our exam prep course. Our 90-hour course, as well as core or bridge, are also available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. Now, at LER, we believe that access to high-quality education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. In this year, and actually right now, our Rising Tide Scholarship is the scholarship applications are open. So you can find out more information on our website, lactationtraining.com/Rising rising tide. The application, the receipt of applications will close on the 22nd of July, Monday, at 11:59 p.m. Eastern Daylight Time. Just want to be clear. So our team is here to help you now and in the future. We have tech support open 7 days a week. You can get your questions answered by content experts in the field, and ongoing support. We can provide you with that for the next steps in your career. So there are times when sometimes the students will reach out with a question from their own practice. We can connect them with the right instructor. Sometimes people have questions about different policies and how they can create similar policies at their hospitals, and we can take a look at our instructors and find someone to answer those questions and to provide additional resources. Thank you so much for your time today. Okay, what questions do you have for us? I know before I started talking, Sekeita, there were many.
Yes.
So please tell us where we're starting.
Well, let's start with this question. I am an ER nurse, so I believe Pathway 3 is best for me. I would get an IBCLC mentor to do 500 supervised hours with me. I want to make sure that's the right pathway and how I submit who my mentor is and get it approved. And so because you're working in the ER, Pathway 3 will probably be the best pathway for you. If I'm perfectly honest, I was working in maternal child and I still did Pathway 3. You know, I just want to be clear about that. I'm very clear about getting the hands-on clinical skills that are necessary to become the best clinician that you can be. The way you would go about Pathway 3 is you would need to link up with a mentor. I believe that IBCLC has to, there used to be a rule, Angela, I could be wrong, that you had to be an IBCLC for at least 5 years before you could mentor. That's no longer a
Not
thing.
anymore, no.
Okay. So you would find an IBCLC to partner with, and the relationship that you develop is based on a relationship that between you and that mentor, but that mentor would have to sign off. And there is an application process that has to happen prior to you basically stating you're a pathway student. It has to be approved. And so if you go to the website, you will find more information on the IBLCE website. You will find more information on what things need to be submitted. But the actual person has to be an IBCLC that is in good standing.
Mm-hmm. That's good.
That, Angela?
I think that's really good. I think that I agree with you. I think having someone who's working in maternal child and working in lactation is something which is really key. And so, yes, I would agree that Pathway 3 is probably the best for that person as well.
All right. There's another question, and I will pass this to you, Angela. But this person left, but I think maybe it's beneficial. If we completed the CBS and we mentor an IBCLC as well as open our own business, do both of those count as clinical hours? Let's start.
I want to assume that they mean they're being mentored by an IBCLC. I mean, the thing is that can you open your own business? You can, but if you're Pathway 3, you're going to have to, though, work out with that IBCLC how you can do that, because they have to supervise you. And the definition of supervision is something which needs to feel comfortable to the two of you, or if there's more than one IBCLC. So everyone needs to be on board because they have to sign off on that Pathway 3 plan. One quick note, if you are a certified breastfeeding specialist, a CBS, which is our certification, and you want to open up your own business, you can, but the steps that you need to open up your own business are not included in the hours. So just want to be clear about that. It's only the service that you provide to the families in your community. The person is also then asking about sessions, if some of them are virtual. Again, especially if you have never done this work before, I would encourage you to provide that sort of care one-on-one. You know, doing things virtually is something which is a different skill set. And so as someone who's been in the work for many, many years, I started out working, okay, now y'all are gonna know how old I am. I started out working on the phone. And so I had a list of vetted questions that I would ask folks whenever they called, so that I could help them with whatever issues they had. And it took me a while to get those list of questions. And so I would say that if you're starting out on your own, that sort of in-person thing is where you're going to learn the most, and it's going to be the most impactful for your practice. Anything, you were smiling, Sekeita, anything you want to add to that?
I was smiling because I don't like telehealth, first of all, but but I have done some successful telehealth visits, quite certainly. I also know that the opportunity, if particularly if you haven't had experience, the opportunity to miss things, crucial things, relying on telehealth, is certainly one of the things I question ethically. Like, I really want to do a research about this, a study, because what do you do when you've helped all you can help and they do need someone to come hands-on? It's certainly wasted the family's time. And not saying that telehealth has a space, but I'm of the mindset that there are certain concerns we can do telehealth, and there are certain concerns that should never be approached from a telehealth perspective. And so that's just from practice, that's just from seeing things in the field, seeing harm being caused. But as new clinicians, I do want to encourage you to think outside the box and really be able to get the clinical skills, because lighting is everything when it comes to assessing babies. How do you get the correct lighting of, there are times I've gone in the house and I was like, whoa, this baby is really yellow. Like right now, I think I look real yellow here, right? Like, but I could go on and on, but I was smiling because I just had this conversation with another colleague about
exactly.
Slope of telehealth. Yes, and like there is space for telehealth. I'm not even, and it's helpful to some parents, absolutely. But again, the one size fit all, thinking that if you're going to base your practice on telehealth only, you might want to think about what types of visits you're going to do, because it's so much. And I think that particularly when you're charging families as a lactation consultant and branding yourself as a lactation consultant, they're coming to you thinking that you're going to help them solve it, and they're not going to have to go to 5 different practitioners just to get help. And so it's a slippery slope. That's my own personal thing, but I want to give you the mindset of what I'm seeing in the land of telehealth. And so that's what my smile was about.
Well, and you got me thinking as well that I think it's important to be transparent with the families that you serve, meaning to let them know that you're providing this support as a certified breastfeeding specialist. And to note that, a certified breastfeeding specialist, like a lot of the other certifications which are out there, except the IBCLC, they support the normal course of breastfeeding. Or if there's specialized knowledge, for example, in a NICU, then they have you have specialized training in order to work in that setting, for example. And so I think it's something which is important to note, that you need to be transparent with the families that you serve as far as the level of education as well as the clinical experience that you have, and make sure that you're, basing that and walking into that space very humble. Again, humility is another piece of this, that, even I, who've been around a long time, I'm not going to say I can fix every problem, because that's just not true, because there are going to be things that I just don't know. And so, again, this is always emerging. Okay.
I do want to say about the CBS. There was a question. If you are a CBS and you have not gone to our website and reviewed our scope of practice, please do. I find that a lot of our CBSs are like, wait, how do I know? What do I compare? What do I use to leverage getting a position at a hospital? How do I make them understand it's comparable to a CLC? It is going to our website and pulling up the scope of practice to really prove the point that these are the skills that you have to be able to.
Very important. That's true. Okay. Someone's asking if, what is the best thing to do, if you should do the, the college courses first, or the 95 hours, or anything like that. I mean, I think before you start providing any sort of clinical care, you need at least the 95 hours or the 54-hour CBS. But just keep in mind that, there are certain things that are not covered in that 54-hour course. And so do think about that as you are planning it out. And as Sekeita said, really do plan it all out, to say, this is what I can do here, this is what I can do here. And keep in mind, how life, just as Sekeita often says, I'm going to quote her, how life keeps lifing. And indeed, you want to make sure that you have the capacity and the flexibility to do what you need to get all those different components together. So, okay, let's see,
Yeah,
what
thanks.
else
And
is here?
I want to add to that a both and approach. One of the things is if you have not, because the way IBCL, the way the credential works is all different backgrounds come into this field. So if you have not had any college courses on, for example, medical terminology and things of that nature, I think that yes, and so yes, you can do CBS, but I think that having some foundational knowledge helps you with the coursework. It helps you also to understand, again, the medical terminology piece so that when you're reading things in the coursework, it makes a little bit more sense. It doesn't seem foreign to you. And so think about it from that aspect, but you don't have to do it a certain kind of way. It is just more beneficial to you if you honored the both and pieces to it.
That's a good point. Thanks, Sekeita. So someone is asking, can we still use the discount through Walden for the health sciences if we do that before the lactation education? You can, if you'd like. You just go to our website and click on the link to Walden University. You have to say that you want to be an IBCLC. Click on that link, and then there may be another link or two, which will get you to the link to Walden University. And they have all of the 8 college courses, which are, if they're not listed on their homepage, I think they have 6 listed on their homepage, and then there are like 2 or 3 others that are listed in a different aspect. Customer support just helped me to find out where that is on the Walden page, and so did the Walden folks as well. And I really want to say that the price of those courses through Walden University is absolutely phenomenal. I mean, they are courses that are all virtual. They're instructor-led. I believe a textbook is not required. And so you can do everything that you need to with each one of those college courses through Walden University. And so they've really been a great collaborator with us to try to remove some of the barriers to becoming a lactation consultant.
Angela, what kind of specialties do lactation consultants work with other than just latch? As in, what should we ask a mentor to make sure they fit what kind of lactation consultant we see ourselves as becoming in the future?
That's a great question.
I love that question.
Go
Yeah.
ahead.
I love that question. In all honesty, lactation consultants we do relactation. We do, again, those high-level cases, supplemental nursing, system. I mean, I think it's gamut. It's a whole wide range of services we offer other than latch. We offer assessment. We make sure not just assessment of the birthing person and mother. We assess infants, the oral assessment of a baby. We're looking at their tone. We're critically thinking and clinically managing and making recommendations based on our impressions of what's happening at feeding. So maybe it's not latch, for example, on the birthing person's end. Maybe the baby is hypertonic or hypotonic. So we are truly specialists in infant feeding when it comes to feeding at the breast and providing human milk. And so I want to just make that clear. Other than just latch, there is a gamut of things that we have to work with that becomes more complicated. Use of any type of medical equipment, be it a nipple shield, be it a pump. A pump, all pumps are not made equal. All pumps don't work for everyone. And so there's a variety of things. And so what should you look for? What I always advocate for is that maybe you have one mentor, but maybe that mentor has connections, or maybe you can seek out your own connections. You may not actually physically be able to touch, but maybe you can go to a pediatrician's office and maybe shadow. maybe you can shadow in the NICU, and that might be slim, but just saying, using connections. There is a wide range. So just because you have a mentor, you whatever that mentor specialty is at IBCLC, you probably will see the most of what they see, right? But also creating opportunities in your community. You know what, networking, what happens at WIC. I'm not sure if there's any opportunities to go in the IBCLCs at WIC and see what they do, right? So I'm from the framework of creating possibilities and opportunities for yourself to become a wide range clinician, and whatever that looks like. So if you work in a hospital system already, you are clueless as to what people are dealing with when they're weaning babies and
Right.
bottle refusing babies. Those are the types of things that you see outside of the hospital setting, outside of the first 2 to 3 days of life, or in the NICU, right? And so whatever that looks like is creating opportunities for you to see things that you normally don't see. And so those are my recommendations. That was long-winded, and I apologize, but go ahead.
No, that's perfect. No, that's perfect. And actually, I just realized that I have this printed, old school, right? Okay, this is the detailed content outline from IBLCE. Take a look at this, go through all the pages, and ask someone, how much experience do you have in each one of these different? There are 7 different sections. There's pathology, there's infant and maternal. Under pathology, there's pharmacology, toxicology, ethical and legal issues, research, public health and advocacy. The IBCLC needs to do all of these things. And so go through this and ask the person that you're dealing with, how often do you deal with these situations? There's a few of these issues where I've rarely dealt, like some of the issues around pathology, I've rarely dealt with, but other issues I have dealt with quite a bit. And so it may be that way that you can sort of balance it out and go through the detailed content outline with a potential mentor and say, I know, for example, there are some people who do a lot of work with pumps, and they do a lot of work with pump fitting. But how often are they then advocating? How often are they working in other aspects? How often are they counseling about, pharmacology and toxicology? How often are they dealing with, food intolerances, nutritional requirements of the infant? So ask them those sorts of questions, and I think that might provide you with more information, along with what Sekeita suggested as well.
I love that, Angela. That was like right on point that you had the detailed content outline right there. I love that.
Just happened. Yeah.
Here's a question for you, Angela. Hi, I'm a midwife at a hospital in Barbados in the Caribbean. I don't think we have any IBCLC mentors in my country. So which pathway should I do?
Well, I would say probably, I would try to find if you have IBCLCs in your country. IBLCE lists the number of IBCLCs in each country on their website. And so you can find out if there are any in your country by going to the IBLCE website. You could also do find a lactation consultant through various national organizations. You may be able to find, in international organizations, you may be able to find someone. And so if there are no IBCLCs in your country, then that's where you would probably want to do pathway 1. And so I would suggest that you take our certified breastfeeding specialist course, either the core course or LCTP, the 95 hours or the 54 hours. I would suggest that you take one of those and see if that fits for you, and then go through it there and maybe then apply to our hours program in order to start to count your hours working as a CBS. Anything else with that?
Not with that, but here's another question for you. As an IBCLC, can you work with families all over the world in person or telehealth? Are you limited to work with families within your country, city, etc.?
So as far as I'm aware, there is no geographic limitation to where I can work. As an IBCLC, I have counseled families all over the world. And so there's no restrictions in my current jurisdiction, nor, it's important for the families to know their geopolitical region and whether or not someone can provide care, either telehealth or directly. And so I would say it's important to look at the laws of your own individual country in order to find out, as well as if a family reaches out to you from a different country, then ask them if they are aware of any sort of limitations as far as offering that care. Any other ideas from you, Sekeita, about that one?
No, I only think from a standpoint of, if it becomes complicated and turns into a complicated situation, where's your follow-up?
That's
How does
right.
it
Yes.
work? Closing the loop of care. But that's always how I think. That's how my mind works. So, but I agree with everything you said, Angela. There's
Good.
another question that says, I have 8 years experience as a NICU RN, but left in 2011. I work in IVF now, so I haven't had lactation support experience since 2019. Should I go with pathway 3? That's a challenging question because you could probably use some of your hours. Well, no,
It's
2019,
2019.
5 years, no, it won't work. Possibly if you're not with families per se to get any of the hours, that pathway 3 would be probably the better pathway based on the experience that you shared. Absolutely. Anything?
And yeah, I was going to say, and though, if you still have connections in that NICU, could you go and volunteer there? Because if you could go and volunteer there, then you could do pathway 1, and then there's more flexibility for you. So you can do it during your off time.
I love that idea. Thanks, Angela. Thank you. So this is a question. So if we shadow in multiple areas, but have an approved mentor that knows we are doing that, perhaps they would sign off on those hours in multiple locations, even if they're not all with them. Or would they only be able to sign off on the 500s directly supervised? They would only be able to sign off on the 500 hours directly supervised. Doing those other experiences will give you more of a better hand. Actually, will help you probably with the test. But it, but it would also give you an idea of what families are experiencing, for example, in the NICU, what they're experiencing actually post like into 6 months into their feeding experience when they have to start to offer complementary foods, or what they experience then when they're returning to work and now baby won't take a bottle, right? So it's so many different situations, but this would not, it would not be, it would not help in your 500 hours. They have to be directly supervised.
They do. And if you have multiple mentors, then they could sign off on the things that they supervise.
Yeah.
And so that's just something important. Someone is asking a question and they only asked a quick question. Oh, so I don't know. So someone asked a question, how about pumping? And I don't know what that context is. If you're, I think, so I'll just say, if you are working with families who, or people, let's see if they added something to that. No. So if you're only working with families who are exclusive pumpers, that's wonderful. That's great. And the question to you then is, how will you get hours working? How will you get hours or experience in the other areas of the detailed content outline? That's all. Really the detailed content outline, it used to be known as the exam blueprint, and that can be the blueprint for what you need to study, where you need to study, where you need to focus your efforts so that you can get experiences in those areas which are not, that you don't have direct access to on a regular basis.
It looks like one last question that I'm seeing. How do I document my unsupervised clinical hours, and how do I submit same? So your unsupervised clinical hours, if you were talking about pathway 3, they wouldn't count. That would count towards your lived experience, your experiential knowledge, but you wouldn't have to necessarily document any like shadow hours that you do. I'm hoping, I'm not sure if you're talking about pathway 3 or not. Angela, I see your finger.
I wonder if they're talking about pathway 1. So if you're talking about pathway 1, then
Okay.
it's self-documentation. Yes, there they are. Pathway 1. Okay, good. So yeah, self-documentation for that. IBCLC has an exam calculator. For people who are in our hours program, we actually provide you with a spreadsheet, a Google sheet, so that you can keep track of it. And yes, it's hour by hour. You don't need to divulge any patient, protected patient information. And you do, though, want to, thanks, Wendy. Wendy just popped a link to the practice calculator into the chat. So you do not need to provide any, protected, any privacy information from the patient, but you do want to say, the date and how many, who you saw and what the general topic was that you covered, position and latch or back to work or relactation. You want to say something about what you did on that specific day to help to help you to remember in case IBCLC chooses to audit your application.
Great stuff, Angela. Thank you for that.
That's very good.
I don't see any other flagged questions for us unless you do.
I don't. I think we're golden.
Yeah, I think this is a great section. I love the questions.
Yes, thank you all very much for the questions. And if you do have further questions, you can reach out to us at support@lactationtraining.com. And if hopefully you had a chance to grab that handout. It is right below the questions bar. It says handouts. And so it says 2024 Real Talk handout from Lactation Education Resources. So thank you very much for joining us today.
Yes, thank you, and enjoy the rest of your day.
Bye, everybody.
Bye.